Hey, this is Dr. Matheson Harris with Harris Eyelid Facial Plastic Surgery in Salt Lake City, Utah. I just got done doing a bilateral ear gauge repair, and I thought I'd answer a few common questions we get from patients who are looking into this type of procedure. Almost all the patients we see for gauge repair are between the ages of about 17 and 30, I'd say. So for the most part, they're kind of early in their life and careers, and typically the expense of gauge repair can be a bit of a factor as to whether or not they get it done. We've always tried to strive here to keep our cost as low as possible, and we recommend that people just send us a email with a picture of their gauged ears, and we can give them an estimate right over email, or having them call in and text the picture so that they can know ahead of time what the cost is, because we know that can be a factor on whether or not some people can get this done. Once we have you in the office, though, we can typically do the evaluation and the repair at the same time, just to save you extra time, especially when we're seeing pictures ahead of time. Now, the repair involves about half an hour to an hour worth of time, depending on how extensive it is. In most cases, we have to do some excision of tissue within the gauge opening, and in some cases, an additional wedge of skin from the outside edge of the earlobe to get the tissue edges to come together nicely and get a good final shape to the earlobe. This involves cutting with a blade as well as with some cautery at times. And then we usually do 2 layers of stitches, both deep and superficial, to get everything to come together nice. At the end of the procedure, we usually cover the incisions with some ointment and just send you out without any bandages over the ears. Care afterwards simply involves just keeping them clean. You can shower the next day. We just have you put some Neosporin ointment over the incisions, and within about 2 weeks the stitches have dissolved and you're good to go. We like to see you back after 2 to 3 weeks just to ensure that we're happy with the shape of the earlobe and to make sure all the stitches have dissolved completely. Some of the other questions we sometimes get about ear gauges, people want to know if they can have their ears pierced again afterwards, and usually I recommend waiting about 2 to 3 months before I would consider re-piercing. You definitely wouldn't ever want to try and stretch the ears again, as the scarring would likely cause an uneven stretch and would result in a really poor appearance. Piercing, however, with just a straight small hole does very well, and piercing straight through the scar tissue area is possible after a few months. If you have any questions about ear gauges or the repair thereof, feel free to email me at drharris, that's Dr. Harris, drharris@utahoc.com, or give our office a call, 801-264-4420, and we can answer your questions. Thanks, and have a lovely day.